Sleep apnea affects the whole body from top to toe, because obviously sleep is supposed to be refreshing for all your organs, not only some of them. And this is why the first danger of it, if left untreated, is that it's going to affect the body from top to toe. So higher risk of stroke, high blood pressure, depression, memory loss, you name it, everything, impotence, especially men. I mean, so all this can be potentially a problem, and so it's essential for obstructive apnea to be treated. The diagnostic of obstructive sleep apnea in the lab can be a little bit tricky, of something that's called Schrödinger effect. That is the name of a German scientist who wanted to study the behavior of a cat in full darkness. In those days, they didn't have infrared light. So when he he made the conditions right for the test, he couldn't carry out the test. Because the only way he could do the test was if light came in, which then made the conditions not right. And in science, we call this a Schrödinger effect. This is all kind of tests that are affected by the test itself. And sleep is one of those. Because if you touch someone to wires and they're not sleeping in the room, etc., they're not going to sleep in the same way that they do at home. And this is why in the lab, the tests can be a little bit biased, or even more, not more than a little bit, they can be biased. This is why we rely a lot on clinical findings, symptoms, questionnaires, etc. And in children, nowadays, parents have been very good in using mobile phones to do a video recording of their children, their breathing patterns at night, when they gasp for air, etc. Because what we want to do is determine if there are periods of apnea. That's when they stop breathing during the night. Unfortunately, a magic wand doesn't exist. There are certain measures. I mean, of course, I'm going to talk about adults and then children. In adults, weight loss is extremely important. Changing habits, especially in relation to smoking, eating habits, drinking habits, alcohol, all the things can make you more prone to suffer from obstructive apnea. So weight control and lifestyle modifications are extremely important, and they must always be done first. And number two is surgery. Especially if there is anatomical problems in the throat or in the nose, in the airway. Although surgery is not the ultimate and the best solution. The gold standard for a treatment of obstructive apnea is CPAP. This is a machine that blows air down your system at night and past the obstacle, wherever it is. This is very effective in treating, but unfortunately the compliance with it is very low. Patients are usually not happy to wear a mask over their nose with a small pump on the bedside. It's not a very attractive kind of treatment. There are also mandibular advancement systems, and there are as well more complex surgery. So there are surgical and non-surgical treatment, but the most important in my mind remains weight control and lifestyle modifications. That's in adults. In children, of course, the treatment is more time critical, and it's obviously very important to treat in children. In children, surgery is very effective, a lot more effective than it is in adults. In particular, by way of removing the tonsils and adenoids. It helps a lot, and most of the time, it treats those children from the problem. There is no urgency per se in adults because there is no imminent threat to life. For example, patients don't die from obstruction; they die from complications of it. So urgent it's technically never urgent in adults, but it's always good practice to treat the problem promptly because of its high morbidity and because of its effect on health. The same in children. In children, it's even more urgent, but not medically, a big emergency to treat in children. Surgery, it can sometimes be, of course, required, either because sometimes can rid you of the problem altogether, or as an adjunct to, for example, treatment with CPAP, because if there is an obstacle in the nose, say, the CPAP machine would have to pump at a higher pressure, and then the tolerance of it becomes less. Whereas if there's no obstacle in the nose, the pressure setting on the machine is lower, and then it's much more tolerable for the patient. Surgery as to when, it is really at the beginning of the treatment if it's required. And then if there is a failure of the other measures, in particular, if there is a low compliance with CPAP, then surgery must be considered. In children, surgery must be considered in the first instance before anything else.